On March 15th, nurses at Crescent City's Sutter Hospital held an informational picket to push for a response from Sutter Health Administration regarding contract negotiations that started 9 months ago. The administration's refusal to address staffing, workplace violence, and pandemic preparedness brought the nurses of 14 Sutter hospitals to join the California Nurses Association in June of 2021. Tiffany Dodson, a registered nurse in Sutter Coast Emergency Room, spoke with KFUG about the push for a new contract and further advocacy to address these matters.
We've had 2 RN positions cut from the emergency room at the beginning of a pandemic, which is a pretty huge cut when you're needing nurses. So we're kind of advocating to increase our staffing so we can be a little more proactive with our care, not be reactive.
Safety and increased staffing are issues the nurses of Sutter Coast want to have addressed and codified in current policies and procedures.
As far as safety, I think it's important that we enhance their current safety. I think we're all striving to continue having a safe work environment, but there's always room for improvement. One of those, as we said earlier, was safe staffing. We want to be a little more engaged and collaborate with administration regarding current policies and procedures that are occurring in the emergency room and other departments throughout the hospital.
Dodson believes that working cooperatively with Sutter Health's administration could foster progress in contract negotiations, as well as achieving better nurse retention and a safer workplace.
We're having to put a lot of pressure on Sutter administration to get things done, and with a contract that would help us be advocates for the community to make sure that we're being able to provide that safe and patient care. Having education for nurses is important. Making sure that we have nurses that are experienced is important. Making sure that we have retention, people that stay in the community, it's a big deal. So being able to be a voice for the patient, because we're seeing frontline what's going on at the bedside, and being able to collaborate with them to make better processes.
Eric Pope is the husband of a nurse at Sutter Coast and has seen the treatment of the nurses there. Understaffing is one of the issues that has increased the need for nurses to organize and form a union.
Well, she works long hours, and I don't think she gets the recognition that she needs from the hospital itself. And then she's always called in to work overtime, stuff like that. She doesn't always answer yes, but sometimes she does. They were even calling her in to work when we had scheduled vacations. So, yeah, they need more staffing.
The shared workplace experiences of nurses at Sutter Coast Hospital and the desire for improvements in their working conditions have led the nurses insisting that their voices be heard and that they have a place at the negotiating table. Amber Faust, a registered nurse in the ICU, believes that a fair contract for nurses and a strong voice for local nurses will benefit the entire community.
I want to see us win a strong, fair contract so we can recruit and retain nurses that are going to be invested in our local community.
The nurses of Sutter Hospitals across the North Coast have been holding informational pickets for many of the same reasons. When the safety of our community's caretakers are at risk, it's best to listen. Redwood Voice will keep you updated as contract negotiations move forward. This has been Sebastian for Redwood Voice.